In order to effectively contour and define the mid-face area, one common approach is to utilize cheek augmentation. Cheek augmentation, much like various other forms of facial augmentation procedures, can be successfully achieved either by strategically enhancing the underlying soft tissue layers or by carefully augmenting the structural hard tissue of the face. But which one of these is better? Hard tissue augmentation means using a cheek implant. A cheek implant helps the cheek tissues appear prominent without adding excessive volume, and this especially shows better results during facial movement. You have surely seen people who, when they give a wide smile, find that a large and noticeable amount of soft tissue gathers around their eyes. This often makes their eyes look significantly smaller than they actually are, and this is especially common in those individuals who have had fat injections several years ago. Or perhaps people who have used a lot of dermal filler over time to enhance the volume of their cheeks. Remember, when enhancing features, proportions must be maintained for the result to look beautiful. Whether we choose to enhance the hard tissue or the soft tissue depends entirely on the specific underlying structure of the patient's facial anatomy. We need to carefully determine if the skeletal bone structure has not developed to its full potential and should be surgically augmented through the placement of a medical prosthesis, or if the overlying soft tissue is simply too thin and should be enhanced using professional dermal fillers or autologous fat grafting techniques. Sometimes the cheekbone itself may have developed well, but the tissue beneath the cheek hasn't, or the cheek may have atrophied due to aging. In such cases, the prosthesis we use is different from standard prostheses, and we need to keep this difference in mind. Additionally, the placement of prostheses differs slightly between men and women. In women, the prosthesis is usually placed more internally and towards the front, whereas in men, we prefer to place it higher and to the side to make the bones appear more prominent and give the face a more masculine look. The incision for cheek prosthesis can be made from inside the mouth, and fortunately, no surgical scar is left behind. However, during a cheek and temple lift, we can also place the prosthesis using the incision made in the temple area. It has a lasting effect, and unlike what many people see with breast implants, it does not require periodic replacement.